Acceptance and commitment theory. The agenda for today is we're going to do an introduction to the treatment, which is acceptance and commitment theory. The research used for acceptance and commitment theory, the techniques and principles, and then the role-play reflection. Introduction to acceptance and commitment theory. Acceptance and commitment theory was created in the 1980s by Stephen C. Hayes, a psychiatrist who struggled with his own panic disorder. Acceptance and commitment theory, also known as ACT, is a form of therapy that focuses on the relationship between cognition and language. ACT is a form of therapy that focuses on helping a client to maintain their thoughts in a healthy manner rather than suppressing or denying normal occurring thoughts or feelings. The research used for acceptance and commitment theory. ACT is used on several different populations to help individuals who struggle with anxiety, depression, substance use disorder, work-related stress, chronic pain, OCD, psychosis, and eating disorders. ACT has been successful in helping individuals who struggle with these issues to understand how their thought processes work and how to handle them in a healthy manner. Many studies have been performed using ACT. One study in particular was performed on a breast cancer survivor who was suffering with chronic pain and depression. Along with the depression, the patient and chronic pain, the patient struggled with fear of the cancer returning. She also had post-surgery pain and had to leave her job. The study consisted of 17 sessions and 2 follow-up sessions over a course of 6 months. After undergoing the acceptance and commitment therapy, the patient was able to go back to work. She developed new hobbies as well and made healthier lifestyle decisions. It stated in the article that she started exercising more and eating healthier due to the therapy, and that it was very successful. There's been other studies done with acceptance and commitment therapy that I had found, other articles that they had done. Another one was on children's parents took a online acceptance and commitment therapy course, and they stated that their children who had diabetes or disabilities did much better with the parents learning how to handle it better using the acceptance and commitment therapy. The children weren't required to do it, but the parents were, and they stated that they were able to manage life better and help their children more. Techniques and principles. There are many techniques used in ACT that can help clients who struggle with the mental illnesses mentioned previously on the other slide. The 6 main principles I chose to use in my role play are the following. 1, acceptance, which is acknowledging your thoughts instead of avoiding, denying, or suppressing them. Acceptance is just accepting the thoughts that you're having and learning how to face them head on instead of just trying to avoid them or push them away to the back of your mind or just not wanting to deal with them. Number 2 is cognitive diffusion, noticing how you react to those thoughts or feelings and changing your reaction to a more positive one. The way that I described cognitive diffusion to Maria was I asked her, how do you normally react when you start having racing thoughts or anxiety? She stated that she shuts down, and I advise to for her to think about how she shuts down and how that affects her in a negative way, and just to try and change the way that she handles it, and just give herself 15 minutes and try to calm down and listen to the thoughts. Number 3 is being present, remaining in the present with your thoughts and observing them fully without judgment. This means not judging yourself for having these thoughts, not saying, oh, I shouldn't have these, they're not normal, what is wrong, and just being negative towards yourself for having these, and just trying to remain present with your thoughts instead of thinking ahead or thinking of the past, and just trying to be there. Number 4 is self as context, viewing yourself as more than those thoughts or feelings. The way that I would put this to Maria is, I'm pretty sure I did in the role play, was just to not be hard on yourself for having thoughts or feelings, not think of yourself as less than, and just know that you're more than those thoughts or feelings that you're having, and understand that those thoughts and feelings do not make you as a person. Number 5 is values, choosing personal values to live by to help form better reactions and behavior. These can be spiritual or other values that people may live by, like certain things that they do or don't want to do that they find helpful to them, and positive values that they set for themselves. And the last one is number 6, which is committed action, taking steps to live by the values you have created to better your behavior and reactions to the thoughts and feelings. It goes along with number 5 values, just using the values that you set for yourself, whether they're spiritual or not, and just using those to create better behavior for yourself and better reactions that you have to the thoughts and feelings. I also chose a technique called anchor breathing or grounding, which is breathing in deeply and exhaling slowly when you feel anxious or like you're going to panic. It's called anchor breathing because the breathing is used as kind of like an anchor, like on a ship. It anchors you and grounds you so that you're not having these racing thoughts, and that's all you're able to think about in the moment. The roleplay reflection, how I use this technique in my roleplay. In the case of Maria, she was suffering from the recent loss of her mother. She described having racing thoughts of worry of what she was going to do now that her mother was deceased. Maria worried about being alone since her husband was out of town for work, and about her children, and had trouble sleeping. I chose to use acceptance and commitment therapy because I felt like it was the best option for her care. I think that in this situation, it would be best for Maria to help change her outlook on the thoughts and feelings. I think that Maria could benefit by learning how to deal with these thoughts in a healthier way. In the role play, I advised Maria on the 6 principles, and she said she was going to try those in the future, which in the role play scenario, Maria was just having trouble sleeping because she was up worrying about the future or the past, and just completely consumed by the thoughts she was having. So I felt like this was the best way to try to get her to understand those thoughts and feelings and change her reaction to them, so that she was able to sleep and get past the thoughts and feelings without them on repeat constantly. In the conclusion, to conclude, ACT is used in a variety of populations to help individuals who struggle again with anxiety, depression, substance use disorder, work-related stress, chronic pain, OCD, psychosis, and eating disorders. Acceptance and commitment therapy helps to confront negative thoughts or feelings to promote a healthy way to deal with them. Accepting the thoughts and feelings and letting them flow is the main purpose of ACT. I used 6 core principles and a technique in the scenario of Maria to help her confront her thoughts in a healthy way and to remain present. And then I created a slideshow, and at the end of the slideshow I put references. Thank you.